In your medical school interviews, it's really important that you're able to showcase that you have a wide variety of knowledge and strong understanding of not just the role of doctors, but also the role of healthcare professionals. So to help you develop that strong understanding, in this video, we're going to be talking about everything relating to physicians associates. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. A physician's associate is a healthcare professional who often has many different roles, including helping the diagnosis of patients, taking histories, overseeing chronic illnesses, and many more roles. Now, it's important to emphasize that with a physician's associate, often they work with the supervision of a doctor, and they work together in order to help come to conclusions about a patient's health and support them on their healthcare journey. Physician's associates, they are not able to actually administer or prescribe any medications or order imaging that requires radiation, and this is where their work is often overseen alongside a doctor. Physician associates require a 2-year postgraduate degree in order to be able to take up this role. Physician associates can often work in various different settings, including GP practices, care homes, and even hospitals. And this is really beneficial because some studies have also shown that they can contribute to patient satisfaction, as they're there to help support within the healthcare system and support patients again on their healthcare journey and work within the MDT. However, for physician associates, some believe that there may be a lack of regulation which could compromise patient safety. This is because physician associates, they often take part in many of the roles that doctors do, and some are worried that this could blur the lines between a physician associate and a doctor, especially because the training pathway is so different, but this may not be clear to patients. When you're talking about physician associates in your interviews, first it's important that you are actually acknowledging the effort and the value that they bring to the NHS. Physician associates work really hard in supporting the MDT, working together, developing treatment plans for patients and supporting them on their healthcare journey. However, at the same time, physician associates are not regulated by a specific governing body, similar to how nurses and doctors are. So when you're talking about physician associates and patient safety, and this is a question that you get, it could be one solution that you can suggest is saying to possibly have a governing body or some form of regulation, as there have been articles, as you may know from online, that sometimes there are some concerns that there may be patient safety being compromised. But again, it's really important that you talk about this in your medical school interviews in a manner that is respectful and mature. It is important that in your medical school interviews, you're able to talk about both sides of an argument, acknowledge that physician associates are really important, but also balance that alongside with the patient safety aspects to help you to do well in your medical school interviews. For more content like this, make sure to check out the rest of my videos as I talk about loads of different other interview topics, including NHS hot topics, ethics, and key principles that you need to know to be able to do well in your interviews.